They help doctors diagnose medical conditions, plan or evaluate treatments, and monitor diseases. Laboratory methods are based on established scientific principles involving biology, chemistry, and physics. The specimens that are normally collected from the patients for testing include blood, liquid or dry, stool, sputum, urine, skin scraping, tissue material, nasal secretions, throat swab, pus, and other body fluids. Once the samples are collected and delivered in the lab uses chemicals to understand the presence of any abnormality in the collected specimen. It is important to test the sample, as tests help the doctors in deciding the treatment plan for the patient. You must assist the nurse or the doctor while the sample is collected and ensure that the sample is delivered into the lab of testing. Principles of specimen collection. While collecting the specimen for testing, it is important to remember the 4 right principles that need to be followed. The specimens are collected by the nurse on the advice of the doctor. The 4 right principles are: it must be reconfirmed that the specimen that is being collected is the same as ordered by the doctor. Certain blood tests must be obtained at specific times. For example, the sample of blood collected to test the blood sugar levels should be done at least 2 hours after the patient has consumed any food. The patient's identification must be verified before drawing a blood specimen. Universal precautions such as wearing gloves must be followed while performing a procedure involving the collection of blood or any fluids. Collection of specimens. The procedures that need to be carried out for collecting the specimens from the patients vary according to the type of the specimen that is collected. Blood specimen collection is performed routinely to obtain blood for laboratory testing. Blood is most frequently obtained via a peripheral vein puncture. Drawing a blood sample and collecting the same for testing is a skilled procedure and is often carried out by a nurse. Based on the amount of blood needed for testing, the sample is collected from the vein or by needle prick. Prior to obtaining blood specimens, the nurse should assess the patient, noting factors that may affect test results, including medications, pregnancy, age, and sex. Blood collection tubes come with a variety of colored stopper caps and may contain additives. This color coding of the blood collection tubes is important to categorize the test that needs to be carried out. The specimen containers should then be labeled and sent to the laboratory. The purpose of obtaining a urine sample is to test for any abnormalities that may be present, such as bacteria or drugs. The nurse should be aware of the qualities of normal urine and note if the patient has any difficulties in passing urine. Then, the sterile container is placed in position and filled with a portion of the urine, taking care that the penis does not touch the sides of the container. When the specimen is obtained, it is sent immediately for testing. If there is a delay in sending the specimen for testing, some organisms present in the urine may die, while others multiply, resulting in a false reading. Sputum specimen collection is a procedure designed to collect expectorated secretions from a patient's respiratory tract. Sputum is collected to be used as a laboratory specimen for the isolation of organisms that might be causing abnormalities of the respiratory tract. This procedure should not be performed if the patient is unable to take several deep breaths or cough deeply from the lungs. Stool specimen collection is a process of obtaining a sample of a patient's feces for diagnostic purposes. This procedure is used to test for infectious organisms, mucus, fat, parasites, or blood in the stool. Depending on the proposed analysis of the feces, watery feces will not be suitable for conducting a test for any fat that may be present, but can be used for other analysis, such as testing for bacteria. In addition to the above specimen collections, other specimens such as throat swabs and specialized specimen collections such as biopsy are also carried for lab testing. Precautions to be taken while collecting specimens. Proper specimen procurement and handling is an integral part of obtaining a valid and timely laboratory test result. Accordingly, specimens must be collected in the proper tubes and containers, correctly labeled, and promptly transported to the laboratory. Always follow standard infection control precautions when handling specimens. For example, ensure appropriate protective clothing is used and waste, including sharp waste, is disposed of safely and correctly. Make sure the patient has followed any special instructions, which could include fasting for a number of hours or taking a medication at a certain time. Write details on container immediately after taking the specimen. Do not take away and label prior to filling. Details should include patient's name and date of birth, type of specimen. The specimen should then be placed directly into the clear bag and then into the specimen transport container. Use proper containers for collection and storage. Using the wrong container often leads to erroneous results. Do not freeze specimens in glass tubes. Always use plastic containers. Laboratory procedures. Laboratories use a variety of methodologies to test the samples that are collected from the patients. The laboratory scientist follows step-by-step procedures until a test result is achieved. Accurate analysis is crucial in determining the correct diagnosis or detecting an infectious agent so that appropriate and timely treatment can be commenced. Factors such as the correct collection technique, storage conditions, and interval before reaching the laboratory, supporting information and patient details are taken into consideration before the test results are finalized. Proper specimen procurement and handling is an integral part of obtaining a valid and timely laboratory test result. It is your duty to ensure that the specimens are collected properly, labeled correctly, and are promptly transported to the laboratory.